Hello, everyone. Bonjour à tous. Welcome and thank you for participating in today's press conference, where we will be providing an update on COVID-19. Bienvenue à la conférence de presse pour fournir une mise à jour au sujet de la COVID-19. We will hear remarks from Canada's Chief and Deputy Chief Public Health Officers, Drs. Theresa Tam and Njoo. The doctors will be available for questions afterward. Aujourd'hui, nous entendrons des allocutions de la Dr. Theresa Tam, administratrice en chef de la santé publique, et du Dr. Njoo, sous-administrateur en chef de la santé publique du Canada. Les docteurs seront disponibles pour des questions après. If you wish to ask a question, please press *1 on your phone. Si vous désirez poser une question, veuillez appuyer sur étoile 1. Alors, procédons. Let's begin. Over to you, Dr. Tam, please.
Thank you. And bonjour à toutes et à tous. The latest surveillance data show that while the Delta-driven wave is continuing nationally, there's considerable regional variation. Areas that have achieved high vaccination coverage and maintain masking, spacing, and other measures where appropriate have been able to keep infection rates lower to protect the health system. However, some more heavily impacted areas are experiencing a strain on healthcare capacity, especially where vaccination coverage is lower. This is both a reminder of the importance of vaccination in our public health toolkit and then reinforcement of the need for ongoing vigilance with other measures to prevent and quickly respond to the rapidly spreading Delta variant. Nationally, the average number of daily new cases being reported is over 4,300. On average, over 2,200 people with COVID-19 are being treated in our hospitals each day, including over 700 in intensive care units, and an average of 36 deaths are being reported daily. These cases and severe illnesses are predominantly occurring among unvaccinated people. From early August to early September, the average weekly rate of new COVID-19 cases was 11 times higher, while the average weekly rate of hospitalizations was 38 times higher in unvaccinated people than in fully vaccinated people. This week marked the start of fall, and as we've already begun the move indoors for back to school and return to work and social spaces, increased disease activity is not unexpected. This means we must keep up efforts and use everything in our toolkit to slow the spread as much as possible to protect lives and livelihoods. COVID-19 vaccination is proving very effective, particularly in preventing severe outcomes, and especially where coverage rates are highest. Although we need very high coverage to offset the highly contagious Delta variant, the good news is that we are continuing to make progress in getting more people protected every day. There are now over 26.5 million Canadians fully vaccinated, which is over 80% of the eligible population aged 12 years or older. On the flip side, that leaves more than 6.5 million Canadians still needing one or more doses of COVID-19 vaccines to be fully vaccinated. Like COVID-19 disease activity, vaccination coverage is not the same everywhere. Where there are gaps in coverage, there will be impacts at the individual level, at the family and community level, and across society and shared services, including healthcare capacity for everyone. As always, our collective efforts matter. We can all help by protecting ourselves through vaccination and indirectly protecting others who can't be vaccinated or who don't mount a strong response to the vaccines. At the same time, our efforts can keep schools open and minimize disruption of vital economic, social, and healthcare services. If you aren't fully vaccinated yet, please access the information and supports needed to join the vaccination firewall. And whether you are vaccinated or not, we need everyone to keep up with individual precautions, including masking and spacing, that help prevent exposure and spread of the virus. Thank you. Merci, Miigwech.
Bonjour à toutes et à tous. Les dernières données de surveillance indiquent que tandis que la vague de variant Delta persiste à l'échelle du pays, elle varie de façon considérable d'une région à l'autre. Les régions qui ont atteint une forte couverture vaccinale et qui ont continué de porter le masque, de maintenir les distances et de conserver les autres mesures de protection parviennent à garder les niveaux d'infection plus bas, ce qui protège le système de la santé. Toutefois, les régions les plus durement touchées vivent également une pression extrême sur la capacité des soins de la santé, particulièrement là où la couverture vaccinale est basse. Ceci sert de rappel de l'importance de la vaccination dans le cadre de l'ensemble de nos soins de santé et le besoin de solidifier la vigilance continue avec d'autres mesures afin de prévenir et d'intervenir rapidement face aux variants Delta qui se propagent toujours. Le nombre de nouveaux cas signalés chaque jour à l'échelle nationale est au-delà de 4 300. En moyenne, plus de 2 200 personnes touchées par la COVID-19 se font soigner dans nos hôpitaux chaque jour où l'on compte plus de 700 personnes qui sont aux soins intensifs et où l'on signale 36 décès sur une base quotidienne. Ces cas de maladies graves et de décès se produisent majoritairement chez les personnes non vaccinées. Entre la mi-août et la mi-septembre, la moyenne hebdomadaire de nouveaux cas de COVID-19 était 11 fois plus élevée et celle des taux d'hospitalisation étaient 38 fois plus élevés chez les personnes non vaccinées que chez celles qui étaient entièrement vaccinées. Cette semaine fait place à l'automne et parce que nous reprenons nos activités à l'intérieur avec le retour en classe, au travail et dans les espaces sociaux, il faut s'attendre à une hausse de cas de maladie. Pour sauver des vies et de protéger nos moyens de subsistance, nous devons donc poursuivre nos efforts et utiliser tous les outils à notre disposition pour freiner le plus possible la propagation du virus. La vaccination contre la COVID-19 se révèle très efficace, surtout pour la prévention de la maladie grave, là où la couverture vaccinale est la plus forte. La couverture vaccinale doit être très élevée pour contrer les très contagieux variants Delta. La bonne nouvelle est que chaque jour, nous continuons de faire des progrès et de protéger plus de gens. Actuellement, 26,5 millions de Canadiens et de Canadiennes sont entièrement vaccinés, ce qui représente 80% de la population admissible de 12 ans et plus. De notre côté, il faut noter que plus de 6,5 millions de Canadiens et de Canadiennes doivent toujours recevoir une dose ou plus de vaccin contre la COVID-19 pour être entièrement vaccinés. Comme c'est le cas pour la propagation de la COVID-19, la couverture vaccinale n'est pas la même partout au pays. Il y aura des répercussions là où il y a des lacunes dans la couverture vaccinale pour les personnes, les familles et les collectivités, ainsi qu'à l'échelle de la société et des services partagés, y compris pour ce qui est de la capacité des systèmes de soins de santé à servir toute la population. Comme toujours, nos efforts collectifs importent. Nous pouvons tous contribuer en nous protégeant grâce à la vaccination et indirectement protéger ceux et celles qui ne peuvent pas se faire vacciner ou qui ne développent pas une forte réponse immunitaire au vaccin. Du même coup, nos efforts peuvent contribuer à garder les écoles ouvertes et à minimiser les interruptions des services cruciaux touchant l'économie, la société et les soins de santé. Si vous n'êtes pas encore entièrement vacciné, veuillez accéder aux renseignements et au soutien dont vous avez besoin pour vous joindre au pare-feu vaccinal. Que vous soyez vacciné ou non, nous comptons sur vous pour continuer à prendre des précautions personnelles pour prévenir l'exposition au virus et sa propagation. N'oubliez pas de vous laver fréquemment les mains, de porter un masque et de maintenir la distanciation physique. Merci. Thank you. Miigwech.
Merci, Dr. Tam and Dr. Njoo. Thank you. We will now open the phone line to questions. We ask that you limit yourself to one question and one follow-up. We will be taking your questions in both official languages. Nous allons prendre des questions. Nous vous demandons de vous limiter à une question et une question de suivi. Vous pouvez poser vos questions dans l'une des deux langues officielles. Operator, first question. Operateur, première question, s'il vous plaît.
Thank you. Merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Sophia Harris from CBC News. Please go ahead.
Hi, just checking if there's been any progress in talks with other countries, including the U.S., on accepting Canadian travelers with mixed vaccines.
Yes, this is Theresa Tam. Thank you for the question. And we have been undergoing very active engagement with other countries, including the United States. We've been presenting our data, for example, in the vaccine effectiveness of the mixed dose schedules, such as AstraZeneca, followed by mRNA vaccines. And the European countries and other top destinations for Canadians. So those are, I think, progressing pretty well, but every country is trying to figure out right now the vaccine requirements. And the US, as you've heard, is just beginning to pull together their policy pertaining to vaccine requirements for entry through the air mode. So we're still working with them on this front, but we have provided information and linking with our counterparts at the CDC, at the HHS and the NIH to facilitate their decisions. Some of the European countries, of course, have already accepted this mixed schedule because they themselves also utilize such schedules. But we still have to advise travelers that they must check in with the specific country requirements prior to travel, because it is a bit of a varied landscape out there, but we're doing everything that we can to facilitate that recognition.
Follow-up?
Yeah, just with the U.S. requirement, is that their vaccination requirement coming in? Is that something Canada is really concentrating on with the U.S. about accepting mixed vaccines?
Yes, we have had quite a series of discussion with U.S. counterparts. Right now, it's not the issue isn't with the mRNA vaccines in terms of interchangeability. It's, for example, they have not used AstraZeneca vaccine in the United States, and certainly not a mixed dose schedule. And as a result, they don't have domestically generated information on that front. So we've basically been providing some technical support to help them make a decision on the mixed dose, particularly AstraZeneca, followed by an mRNA vaccine. So I understand that they are still in the process of deliberation.
Thank you. Merci, operator. Next question, please. Prochaine question, s'il vous plaît.
La prochaine question est de Louis Blouin de Radio-Canada. La parole est à vous.
Oui, bonjour. Question pour le docteur Njoo. Monsieur Njoo, est-ce que vous voyez une façon de freiner cette tendance très inquiétante en Alberta? Est-ce qu'il est trop tard pour renverser ce qu'on est en train de voir actuellement, parce que c'est vraiment rendu très, très sérieux? L'impact sur les hôpitaux est très sérieux en Alberta. Est-ce que vous voyez une manière de renverser cette tendance-là avec un apport de vaccination supplémentaire, par exemple, ou est-il trop tard?
Merci pour la question. C'est un peu difficile pour moi pour commenter sur la situation dans une province ou territoire, parce que c'est vraiment les autorités de la santé publique qui sont sur le terrain et qui connaissent la situation en plus de détails que moi. Mais ce que je peux vous dire, c'est qu'on sait que les indicateurs, comme des tardifs, comme les hospitalisations et aussi même les morts, c'est toujours quelques semaines après les cas d'infection. Donc, je pense qu'on continue à suivre étroitement qu'est-ce qui se passe en Alberta. On sait qu'il y a le système de soins de santé est presque à la limite et il y a beaucoup des hospitalisations, beaucoup de personnes dans des unités de soins intensifs. Et nous autres, de notre part, le gouvernement fédéral, on est toujours prêt à supporter, donner les supports nécessaires avec une demande d'Alberta. Et moi, je comprends que le gouvernement d'Alberta a fait une demande comme dit formelle au gouvernement fédéral, et on est en train de discuter c'est quoi exactement en détail les besoins d'Alberta. Mais Ce qu'on a vu dans les dernières journées aussi, c'est que Alberta a aussi mis en place des autres mesures comme le port de masque obligatoire aussi, un système. Je vois qu'ils expliquent que c'est comme un système pour vérifier, preuves de vaccination pour peut-être les services non essentiels comme dans les restaurants. Donc, ce sont les mesures peut-être pour prévenir les cas au futur, aussi la transmission communautaire, mais pour qu'est-ce qui se passe actuellement, c'est vraiment une question de supporter avec les cas déjà signalés aussi avec les besoins dans le système de soins de santé. Merci.
Je comprends que c'est vraiment le problème majeur en Alberta, c'est la couverture vaccinale qui n'est pas suffisante. Qu'est-ce que vous avez à dire aux Albertains qui hésitent toujours à se faire vacciner?
Moi, je pense, je parle de l'échelle nationale au fédéral. Je peux dire que c'est pas seulement pour les personnes qui sont en Alberta, c'est vraiment pour tous les Canadiens et Canadiennes. On a même dit aujourd'hui qu'il reste encore 6,5 millions de Canadiens et Canadiennes à travers le pays qui sont admissibles pour les vaccins, qui n'ont pas encore reçu une dose de vaccin ou les deux pour être entièrement vaccinés. Donc, ça, c'est, je pense, un enjeu important. On voit aussi que c'est pas que c'est bien, distribué partout dans le pays. Il y a vraiment, certaines régions, collectivités, on sait exactement, c'est toujours peut-être les jeunes, aussi peut-être dans quelques collectivités rurales. Donc, je pense qu'avec nos homologues des provinces et territoires, on continue à trouver des solutions, des moyens pour encourager la vaccination parmi certains groupes qui peut-être sont encore un peu plus réticents. Mais à part de ça, on voit maintenant, actuellement, toutes les provinces et territoires sont en train d'utiliser les autres outils comme les passeports vaccinales, comme au Québec. Je vois qu'est-ce qui se passe au Québec. Au Québec, c'est bien passé. Moi, personnellement, j'ai passé comme une fin de semaine à Montréal et moi, j'ai utilisé le passeport vaccinal du Québec. C'est wow, c'est bon, c'est facile et je vois que pour tout le monde dans les restaurants comme moi, je suis comme rassuré. Ça donne aussi un certain niveau de confiance pour savoir que tout le monde autour de moi dans un restaurant est comme moi aussi entièrement vacciné. Donc, je pense qu'il faut continuer avec nos efforts partout dans le pays, pas seulement en Alberta. Merci.
Merci. Operateur, la prochaine question. Next question, please.
The next question is from Peter Zemonjic from CBC News. Please go ahead.
Hello, can you hear me? Hello?
Yes, we can.
Okay, great. This is a question for Dr. Tam, please. Ontario is increasing the capacity of fans that are allowed at indoor pro sports venues, and Alberta is going to be holding full capacity NHL's games. Could you please tell me what you think the level of risk at this point in the pandemic is to holding such events in such capacity?
Maybe I'll start. I know Dr. Njoo is always on the sports files, so he may have other things to add. And we've emphasized that, of course, some of these decisions are really based on a provincial examination of their own data and the epidemiology, which is clearly different between, for example, Alberta and Ontario. Ontario is actually doing pretty well in terms of the current epidemiology. Of course, there are cases, there are increases, but things are generally well managed, and there's been a significant uptake in vaccinations. Based on what I understand, they too are looking at the vaccine proof or vaccine requirements for sporting events. So they are putting down those kind of mitigation measures, as well as looking at capacity size. And the two all of these pieces have to be examined together. So if you are requiring vaccine proof or testing, then you can adjust your the size of the audience, if you like, and also based on the size and capacity of the actual space that you're in. So it's probably a fairly complex piece of calculation, but I think the Ontario authorities have looked at the current situation and felt comfortable from that perspective to move on to expand some of these gatherings. But I know that my counterparts are watching what happens very carefully, and I'm certain they will reevaluate if those capacity objectives, if you like, need to be adjusted over time. But we do know that vaccinations are very effective, and it's possible that this requirement to have a vaccine proof for such events can stimulate a younger adult population from getting vaccinated as well. So I think certainly contact Dr. Kieran Moore or others for their perspectives.
Yeah, it's Dr. Njoo. Maybe I'll just add a couple of points to what Dr. Tam has said, which I think really covers the waterfront. I would say that with all of the professional sports leagues and teams that we've been dealing with respect to COVID-19, I think by and large, I think they've been very receptive, and they understand the gravity of this global pandemic that we're all facing. And you can see by the sort of the policies they put in, even for their own personnel, the players and so on, in terms of requirements for vaccination. Looking at the NHL as an example, I think that's very good. So from a health and safety protocol, I think they've done all the right things, and we continue to work with them to see if there's any adjustments that might need to be made down the road. With respect to spectators, that's another issue, and as Dr. Tam pointed out, that's more within provincial jurisdiction in terms of, like any other sort of a mass gathering event that needs to be looked at closely by local public health officials, taking into account local epidemiology and so on. A very important component of that is, of course, proof of vaccination, and it gets back to the issue of vaccine passports, and that being a tool to motivate individuals that for no other reason than wanting to go to a baseball game or a hockey game, that it would be obviously important to get vaccinated. So I think there's lots of issues in play from a quote scientific technical perspective. For example, if you're looking at a Blue Jay game that might be taken sort of in an open air stadium, if the roof is open, compared to a sort of a more of a closed setting in terms of a hockey arena, that there's other things that need to be looked at in terms of ventilation and so on. But I think the main principles of looking at vaccination proof for the spectators, as well as the use of other measures like the use wearing of masks being mandatory, are all part of it. And at the end of the day, I think it's a decision to make that looks at all of the factors, and then of course a certain level of risk tolerance involved as well. So I'll leave it at that. Thank you.
Thank you. That's all I have.
Thank you very much. Operator, next question, please. Prochaine question.
La prochaine question est de Olivier Ferron-Boissé de TVA Nouvelles. La parole est à vous.
Oui, bonjour, Dr. Njoo. Je me demandais, selon vous, avec les données que vous avez, les tendances que vous observez, est-ce que la vaccination qui a été atteinte, le niveau de vaccination, l'utilisation du passeport vaccinal va être suffisant pour éviter une situation épidémiologique dans laquelle on se retrouverait à devoir recommander la fermeture d'écoles dans plusieurs régions, avoir des mesures qui s'apparenteraient à un autre confinement?
OK, bon, merci pour la question. Ce qu'on voit quand on regarde les données probantes à date, on sait avec le variant Delta qui est très contagieux qu'il faut, d'après moi, augmenter le niveau de couverture vaccinale. On a parlé avant peut-être d'une couverture vaccinale de 80%, mais je pense que parmi la majorité des experts, on parle maintenant peut-être d'un niveau de couverture vaccinale un peu plus haut, peut-être même 90% ou plus. Moi, Dr. Tam et moi, on a toujours dit que, hey, si on peut avoir un teint, même peut-être que c'est une rêve, mais 100% couverture vaccinale, ça c'est idéal. Mais si on parle pour qu'est-ce qu'on peut faire pour éviter des conséquences plus graves pour l'automne et l'hiver, je peux toujours souligner les points que c'est très important. On peut faire toujours dans les écoles, on peut mettre en place certaines mesures. Mais si on voit des cas dans les écoles, pour moi, c'est vraiment une réflexion avec qu'est-ce qui se passe dans la communauté, la collectivité avec la transmission communautaire, parce que j'ai parlé avec mes homologues et on commence peut-être à ramasser les données probantes, mais ce qu'on voit, qu'il y a beaucoup de cas avec les enfants qui ont signalé avec des cas qui sont dans les familles où il y a quelques membres non vaccinés. Donc, je pense que vraiment, s'ils vont protéger les enfants qui sont moins de 12 ans, qui ne sont pas actuellement admissibles pour recevoir un vaccin, c'est très important pour toutes les personnes, les adultes autour des enfants, soit le personnel dans les écoles qui travaillent ou même les autres membres de la famille des enfants, de se faire vacciner. Ça, c'est d'après la chose la plus importante à souligner pour prévenir les perturbations et pour garder les écoles ouvertes cet automne et hiver. Merci.
OK. Et en suivi, je pense que je reviendrai sur la question des sports. Ligue nationale de hockey, on commence à voir les assistances prévues là, pour les différentes équipes, les différentes ligues, puis on voit des différences à travers les provinces, même les pays. Je pense à des équipes aux États-Unis qui vont avoir des salles comptes, tandis que, par exemple, à Montréal, on parle du tiers là, de la capacité jusqu'à présent qui pourrait être admise. Et même si au Québec, il y a un taux de vaccination plus élevé qu'aux États-Unis, alors ma question, c'est est-ce que selon vous, au Québec ou les équipes au Canada ils vont par une espèce d'excès de prudence ou à l'inverse, c'est plutôt aux États-Unis ou dans certaines autres équipes, d'autres juridictions où on est un petit peu irresponsable avec l'approche d'avoir des salles comptes, même s'il y a un taux de vaccination qui est moins élevé qu'au Canada?
Wow, OK. Mais c'est plusieurs questions là. Je pense, en fin de compte, c'est aussi une question de comme des seuils de tolérance pour le risque. Ce que je peux vous dire maintenant, c'est que si on parle des équipes de hockey à la Ligue nationale de hockey, il y a des bons protocoles aussi, des exigences pour la vaccination du personnel, les joueurs, et aussi des bons protocoles pour comme les comportements, qu'est-ce que les joueurs peuvent faire, peut-être même pour les joueurs des équipes canadiennes basées au Canada et aussi pour les équipes aux États-Unis. Donc moi, ce que j'ai vu, on a la sécurité et la santé pour les joueurs, le personnel, mais aussi pour les Canadiens ici, pour les équipes qui traversent la frontière, c'est pas vraiment une préoccupation. Ce que vous dites, vous posez la question concernant la capacité dans les arénas. Moi, je pense que chose la plus importante, c'est OK. Qu'est-ce qu'on a comme les outils pour minimiser ou au moins gérer le risque? La chose la plus importante, c'est la vaccination. Donc, si on exige comme des preuves de vaccination, le passeport vaccinal pour tous les spectateurs qui veulent assister à un événement sportif, un match de hockey, oui, ça, c'est numéro un. Aussi, les autres mesures de santé publique, même à l'échelle individuelle, on a toujours parlé de le port de masque, le lavage fréquent des mains. Ça, c'est important de continuer avec les efforts. Et à part de ça, c'est toujours, je pense, en fin de compte, une question de, comment dire, gestion des risques, parce que on sait que la distanciation physique est aussi une mesure importante et aussi la ventilation. Donc, je pense que c'est quelque chose pour les autorités de santé publique aussi pour considérer. Pour prendre une décision pour la capacité pour un match de hockey. Mais à part de ça, on sait exactement qu'est-ce qu'on peut faire. Et je pense que si on commence avec un taux de vaccination le plus possible, ça c'est bon. Et je ne suis pas vraiment inquiète pour qu'est-ce qui se passe aux États-Unis avec les spectateurs, parce que pour les joueurs et les équipes qui traversent la frontière, on a des bons protocoles pour protéger les équipes, mais aussi pour protéger les Canadiens et Canadiennes ici au Canada.
Merci beaucoup. Operateur, on parle de la prochaine question. Next question, please.
The next question is from Jamie Morashi from Global News. Please go ahead.
Hi, all. Can you hear me okay?
Yes, we can.
Wonderful. So the WHO today has endorsed the treatment of monoclonal antibodies, but here in Canada, we have just a few thousand doses, Global News has confirmed. So why haven't we procured more?
Sorry. Hi, this is Theresa Tam. So, obviously, there's a range of treatments and not just monoclonal antibodies. And so we have been trying to have an ongoing access to safe and effective therapies as they're being authorized from a Health Canada perspective. So, working with Public Service and Procurement Canada. So there are different ranges of treatment. And so this is not the only one. So we have, of course, the remdesivir, and then other drugs such as tocilizumab, some anti-inflammatory drugs, and antibody combinations. And there are different ones of those as well. So, but what fundamentally determines, the appropriate acquisition administration is through discussions with provinces and territories about their needs. Of course, in a global situation, there's always, demand, but fundamentally is through a discussion with provinces and territories about what they need and their allocations. But of course, we, just like on the vaccine front, pulling all stops to get different doses of these range of medications. So it's not the only drug that we have.
Sorry, just to follow up, I completely understand it's not the only drug that we have, and I'm aware of the other drugs in play here, but I'm talking specifically about, something for earlier treatment, especially for those who are potentially immunocompromised. This has been put forth now as a really viable option. Is it the cost that's kind of setting us back? What is it? What's the reason that we haven't garnered more, I guess?
Yeah, I think it's different factors. It's not really fundamentally about cost. There's access, but also feasibility of delivery. I think there is more opportunity now. For example, one of the antibody combinations used to have to be given intravenously, and there's new data to show that you can actually give it under the skin now. And that might then increase the feasibility of the use of these medications in the frontline setting. So, these are evolving applications. But I do think that these treatments play a really key role in our response overall. So it's great that you brought it up because it should be part of the armamentarium, as it were, to combat this virus. So they are available, but sometimes the demand has not been great from the provinces, but is the reality of the application and the feasibility issues that they face as well.
Thank you. Operator, we can go to prochaine question. Next question, please.
The next question is from Laura Osman from the Canadian Press. Please go ahead.
Good morning, Dr. Tam. I wanted to start by asking you a question about a story that CTV reported about a batch of expired vaccines that went to Ontario First Nation and were administered. First of all, do you have any more details on that? And secondly, what does that do in terms of the relationship of trust with that First Nation and others that you are trying to encourage vaccination in?
Thank you for that question. And I actually was not aware of that very specific situation. But of course, it's very important to, there's a very complex vaccine program that's being delivered on the ground through the provinces and territories. So I think it is very important to have checkpoints to ensure that whatever's being delivered is within the expiry date. So, but I do know that in such a massive undertaking, there could be challenges and issues that will come up. So I think the most genuine way of tackling the issue is having had it identified is for the various key leadership and people trying to deliver the programs to sit down together and understand what actually happened and find a path forwards. So with the intent to prevent any situation like that. So I can't speak to exactly what happened, but it's true that sometimes these incidences do lead to a lack of trust, and which is already very difficult to build. But I think everyone should come to the table with an open mind to look for prevention measures for the next time. But of course, I'm not involved in the specific incident that you discussed, so I can't comment on that.
Fair enough. Thanks so much for that, Dr. Tam. I also wanted to ask you, with the news about Pfizer having more data regarding younger children and the safety of their vaccine and the efficacy, a lot of parents are starting to think about the choice they're going to make for their children. I understand Health Canada hasn't approved the vaccine for young kids yet, but how would you encourage parents to begin thinking about vaccinating their children, given that kids are lower risk, the higher transmissibility of the Delta variant, and myocarditis concerns that were brought up by JCVI in Britain for kids 12 to 15?
Yes, thank you for that question. It is one of the key pieces of vaccine program discussion that is to come for the National Advisory Committee on Immunization. And you just brought out some of the key considerations, which is the balance of risk-benefit must weigh towards the benefit. And all of those considerations you've mentioned needs to be taken into account. And the objective of whether we're preventing transmission of the virus to the individual protection as well. With a very transmissible virus, variant such as the Delta virus, even rare events, of course, can surface and become more common. So we will see children in hospitals as well as some rare but serious cases, and the numbers of those can be significant if there's a lot of viral activity. So that's to be taken into account. The other factor that is being considered, of course, is the issue with the evolving science around long COVID or post-COVID syndrome. And that question pertains to what if you only got a relatively mild illness, but still can have months of ensuing consequences. So it's not just the acute illness, but other impacts. This has then got to be weighed against significant social, educational, developmental impacts, mental health on children for missing schools. So another factor that has to be built in is the minimizing societal disruption, which for kids is about education. So it is a complex set of factors, but all of these, and including ethics, will be factored in along with safety and efficacy. I think parents are mostly concerned about safety of the vaccines. So we do have to see the data from the manufacturer being submitted to Health Canada and move on accordingly. We are, of course, tracking the one age group up, which is the 12 to 17-year-olds. And so far, those programs are going well. There's no specific safety concerns, although myocarditis is something that we're monitoring both in youth and in young adults. And these events have to be tracked on an ongoing basis, and we can adjust recommendations accordingly. So I do think that seeing the safety data in the younger children is of paramount importance, and then balancing it out with all those factors that you've actually also identified. But I think all of my counterparts and the provinces and territories, their prime objective this fall and winter season is keeping kids at school. So I think that will float to the top of the considerations.
Thank you very much. Prochaine question, operator. Next question, please.
The next question is from Jeff Labine from iPolitics. Please go ahead.
Dr. Tam, just keeping on the theme of children here, what are your thoughts on mandatory COVID vaccine for eligible school children?
I think taking things one step at a time is, of course, getting the data on the safety of the vaccine and their immune response in children. So that is step number one. In terms of program implementation, that is in the realm of the province and the territory. Vaccine proof and vaccine requirement has been part of the daily lives of school kids for other vaccines for example, in Ontario. So this is not that different, perhaps, than other vaccine preventable diseases. So this would not be new for the school to take up that requirement. And based on experience with other childhood vaccines, having that requirement and the showing of vaccine proof does serve as a very important reminder to parents and can increase vaccine uptake. So I think provinces will be considering this as one method of ensuring vaccine uptake and safety of the school environment. But again, we're a little bit ahead of the curve here. We have to make sure we have the data on the safety and the immune response and the other considerations first.
How quickly do you think we could implement that? Would that be a quick turnaround if everyone agrees that it's a good idea?
As you've seen with other vaccine requirements for the province and territories, they determine how they roll things out. What I would say is that with the infrastructures being built for vaccine proof or vaccine certificates, this will, I think, make vaccine proof for school attendance relatively easy to do. Having already laid out the groundworks for the systems and the records to be put in place. So if the provinces choose to go there, then I can see that from a records and a technological perspective, it should be relatively easy to do. But it's more the discussions, as you can imagine, with school boards, parents, and of course, the provincial public health departments making that decision.
Any follow-up? Okay, we'll go to the next question, operator. I think this will be the last question. Notre dernière question, s'il vous plaît.
Thank you, merci. The next question is from Christine Barak from CBC National News. Please go ahead.
Thanks for taking our questions. Dr. Tam, just to pick up on the questions of my colleagues, you mentioned that you're keeping a very close eye on myocarditis. Are the rates that we're seeing in the age group that you mentioned higher than in the general population or still within range?
So with the youngest age groups, of course, we don't have the vaccine. With the young adults populations, we are keeping a close eye on those trends because myocarditis following vaccination appears to be higher in the younger adults. So what we are seeing is the rates are not out of the ordinary from what is expected. So there's no specific signal that we didn't anticipate. But it is higher in the younger adult age groups. And we do have slightly different rates for the two vaccines that are being implemented. For Pfizer, the rate is about 1 per 100,000. And I think for Moderna is around 2 per 100,000. And we're observing more in the young adult age groups. And so with the 12 to 17-year-olds, many of this population actually started with the Pfizer vaccines. And because the Moderna vaccine was, of course, approved a little bit later. And so we are, of course, tracking that very closely. And we can adjust, of course, recommendations accordingly. But myocarditis following vaccination is observed, but rare in the rates that I've just stated. And most of these individuals make a good recovery, and that's what we've observed to date.
All right, thanks for that. Dr. Tam, the U.S. Centers for Disease Control and Prevention have approved boosters for high-risk workers, so healthcare workers, even teachers. Should Canada be moving in the same direction? What is the data telling you?
Yes, these are some of the most important decisions from a vaccine program perspective. Last week, yes, I think very recently anyways, the National Advisory Committee on Immunization made a recommendation for an additional dose for those who are moderately or severely immunocompromised. And we expect the next set of recommendations to be focused on an additional dose for those at the highest risk, particularly those who received the vaccine the earliest. So that includes, for example, those in long-term care homes or congregate living for seniors. So I expect the committee to have their deliberations completed on this group, for example, very shortly. But we are using Canadian data to look at vaccine effectiveness because we do have different vaccine approaches to that of other countries. For example, while we use the mRNA vaccines the same as the United States, many Canadians have actually had an extended interval compared to the United States. And what the data is showing us is that the extended interval produces a more robust immune response, and vaccine effectiveness is better with a longer interval. So the Canadian data must be analyzed on top of what we're gathering from the international community as well. And we are taking a thoughtful and phased approach to looking at additional doses. I think the more difficult decisions for really the general population, as I've said in my opening remarks, we're still seeing very good vaccine effectiveness on particularly on preventing severe outcomes. So I would say for the general population, particularly for adults 18 to 39, is to get your first shots, get your primary series. That's the most important, while the National Advisory Committee on Immunization is deliberating on any additional doses to the high risk.
Thank you very much. Merci beaucoup. This will conclude today's press conference. Thank you for your participation. Any additional questions can be directed to Media Relations at the Public Health Agency of Canada. La conférence de presse est maintenant terminée. On vous remercie de votre participation. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias à l'Agence de la santé publique du Canada. Merci et bonne journée. Thank you and have a nice day.